Which communication approach is best for hearing impairments, oral or manual? Imagine trying to have a conversation without hearing or seeing clearly. For people with hearing impairments, choosing how to communicate can feel like solving a complex puzzle. There is no one-size-fits-all answer when it comes to communication methods for hearing impairments. The best approach depends on many factors like how much hearing loss someone has, their personal abilities, family preferences, and what kind of support and technology they have access to. Both oral and manual methods have their own strengths, and often using a mix of both works best. The oral communication approach focuses on developing spoken language skills. It involves listening, speech training, and lip reading. People often use hearing aids or cochlear implants to help hear better. Speech reading, or lip reading, helps understand speech by watching mouth movements. Auditory verbal therapy is a specialized form that emphasizes listening and speaking without relying on visual cues like gestures or signs. It requires consistent practice and exposure to spoken language in everyday life. This method tends to work well for individuals who had some hearing or speech before losing hearing or those with mild to moderate hearing loss. Early intervention with this approach can help children develop speech and language skills that support integration into mainstream classrooms and social settings. Families often choose oral methods if they want their children to speak and listen as naturally as possible. Manual communication methods use hand signs and gestures to communicate. American Sign Language is a full language with its own grammar and syntax, separate from English. Manual methods are often preferred by individuals with severe or profound hearing loss, for whom spoken language is difficult to learn or maintain. Other manual systems include signed exact English, which visually shows English words, and cued speech, which combines hand cues with speech to clarify sounds that look similar on the lips. Manual communication allows for natural conversations within deaf communities and is culturally significant. However, outside these communities, sign language use can be limited, which might make social interactions more challenging. Many people and professionals find that combining approaches offers the best results. Total communication uses a mix of signing, speech, lip reading, and gestures tailored to each person's needs. Bilingual approaches promote fluency in both American Sign Language and English, supporting cognitive and language development in both languages. In special education, the choice of method should be based on the child's hearing level, cognitive skills, family goals, and available resources. Early assessment and intervention are key to helping children develop language skills, whether through oral, manual, or a combination of both. Schools and families should work together to choose the most supportive environment. Support services like speech therapy, sign language instruction, and auditory training are essential for success. To sum up, oral approaches often work well for those with some residual hearing and access to hearing technology, focusing on spoken language. Manual methods are ideal for individuals with more profound hearing loss or those who identify with deaf culture, providing a rich visual language. Many find that a flexible, combined approach best meets the diverse needs of people with hearing impairments in education and daily life.